If you clicked on this video, more than likely you're preparing to get a BBL, lipo, a mommy makeover, or a tummy tuck, and you want to know everything you need to know about massages. My name is Ayana. I'm a licensed massage therapist who focuses on post-op lymphatic drainage massage. I own a company that specifically focuses on people who are recovering from cosmetic surgery. And in this video, I'm going over frequently asked questions about lymphatic drainage massage, and by the end of this video, you'll know everything you need to know. So we're just gonna jump right into the question and answer. If you see me looking down, it's because I literally have my laptop here that has all the questions that people ask me on Facebook in the different cosmetic surgery groups that I'm a part of. I also wrote down some questions that I usually get from clients when I meet with them. So if you see me looking down, I'm looking at the question. So the first one is a big one. This person asked, why is it that some surgeons suggest massages and some don't? Do we really need to pay for them or not? Most of my clients, they seek me out because their surgeon recommended at least 10 massages. Most surgeons are going to say 10. I hear that number a lot. Some surgeons may not suggest it, especially if you do a follow-up with them and maybe your results aren't where you want it to be and you say you got massages. Their first response is going to be, oh, why did you get massages? Or literally there might be a language barrier between you and your surgeon if you went to the Dominican Republic or somewhere outside of the States. But a majority of people, in my experience, in my career, my clients have told me that massages were recommended to them. And I would recommend them as well too. And the reason being, when you get lymphatic drainage massage after surgery, especially right after surgery, you're encouraging your lymphatic drainage system to filter out extra fluid at a really quick rate so that you can see results as soon as possible. It also helps with pain relief. It helps with the muscle soreness that you'll be experiencing when you're in the faja all day. It can help with a lot of stuff, whether that's just inflammation. It can help with getting blood flow to your body, because if the massage is done correctly, it will help bring blood flow, circulation to areas that need healing. And anytime you bring blood flow to an area that needs a healing, it's going to feel more soft, more supple, and it's not going to get that hardness. In my experience, sometimes what will happen is I'll, give recommendations for how often a client should be getting lymphatic drainage massage. And if they're following those recommendations on a regular basis and also doing self-massage, then they're more than likely to have smoother results. They're less likely to get those hard lumps that you'll see on some women. But then those clients who don't follow my recommendations and maybe get one once in a blue moon, they'll call me 3 months later trying to get in because they developed something on their body because they weren't doing self-massage or they weren't getting massages on a regular basis. I would definitely recommend getting lymphatic drainage massage. Yes, you do need them. So when you're thinking about the price of surgery, think about the price of aftercare as well. Think about how much time you have to go get those massages. Which leads us to our next question. Next question says, does lymphatic drainage hurt? I'm actually going to pair that with another question that says, what does it feel like? Okay, so depending on the type of surgery you got, lymphatic drainage, I'm not going to say it hurts, because what is painful depends on the person and how much edema they have, which really means how much swelling they have, and also what the surgeon did to their body. But it is uncomfortable, especially in the beginning. Usually that first week, you're going to be really sore. You just went through surgery and now someone is touching your body with applied pressure. However, usually as you get used to it, it will feel like such a relief to get your massage. Typically in my career, people are happy to see me because they've been in the faja so much that the massage really relieves their muscles, their joints. It really lets them know that they're on track. Usually I try to tell them their progress. So it's just another way to have a professional let you know what your progress is looking like. What does it feel like? So in the beginning, especially if you have a lot of fluid, when we get to the abdominal area, you can literally, you, the person on the table, can feel the fluid moving through your body if it's done correctly, if it's done by a professional who knows what they're doing. You can literally feel the fluid moving, and it will feel just slow. It'll feel a little strange at first. And so that's mostly what it will feel like. Other than that, you may not feel anything at all. Your body may be numb, depending on what type of anesthesia you had, all sorts of factors. I've heard people say that they feel a tingle when they get their massages. People who just feel like they feel a lot looser, like they can move their body around like this a little bit more than if they didn't have the massage. So there's a lot of feelings that can come from it, and it also depends on how far out you are. So someone who is a week out from surgery will feel different than someone who is 3 months out from surgery. Usually 3 months after, you get more used to it, you can have more pressure, but in the very beginning, you really shouldn't have that much pressure at all because we don't want you to bruise during this session. Okay, so the next question says, will you open my incisions? Okay, usually by the time clients get to us, someone has already opened their incisions, down in Miami or Fort Lauderdale. I am not licensed to open any incisions, and actually I recommend that you don't get any incisions open if you can, because the longer your incisions stay open, the more likely they'll get infected. So please, 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 please do not open your incisions yourself, and do not have someone constantly opening your incisions. I know you'll see on Instagram or even YouTube, I've seen some videos of lymphatic drainage massage being displayed as someone opens your incisions and drain you through the incisions. And yes, that does happen. Like, for instance, if your incisions open while you're on my table, I will drain you that way, but I cannot open your incisions because I'm risking the fact that those incisions could be open or could be infected, So I'm risking that your incisions could be infected. And so I don't open incisions. No massage therapist should be opening incisions at all, period. Now, some nurses are licensed to do that, especially if they're under a doctor's supervision. So yes, in the beginning, right after surgery, if massages were included with your surgery, then sure, they can open your incisions and drain you that way and get rid of excess fluid that way. But no one should be opening your incision, especially after the first week after surgery. I wouldn't trust that. That's a good way to get infected, and I've seen those infections, and they're not pretty. And it can also lead to more scar tissue if someone is constantly opening your incisions to do your massages. I know it might feel like a relief to see the fluid literally drain out your body, but I wouldn't risk it, although I have had some clients who will open their own incisions, but that's kind of on them. So just use your own discretion, get medical advice first if you do that, but you really want your incisions to close as soon as possible because that's going to lead to less scar tissue, less of a chance of it getting infected, and it's just going to aid your healing process because the sooner they close, the sooner you can heal. So no, a massage therapist should not be opening your incisions. They are not surgeons. They should not be doing that to your body, especially after that first week of surgery. So the next question, it says, how many massages do I need after surgery? So I get this one a lot. Most surgeons are going to say that you need 10 massages after surgery. However, I don't understand how they can say that, because how do they know how much fluid you're going to present with after surgery? So for example, someone will come to me our first session, and just by doing the session, I can tell how often they should be getting massages. But something I tell all clients is that they should be getting massages for the first 3 months after surgery. The first 3 months is crucial. It's crucial, and they should be getting it immediately after surgery, after that first week especially. they should be getting lymphatic drainage massage. Typically what I see is that, especially a week to 3 weeks after surgery, they're going to need to get massages at least 2 to 3 times a week. As there's less fluid present or less scar tissue or less areas of stiffness, they could get away with getting it once a week. But again, it depends on the person and what they got. Some surgeries are harder to recover from than others. For example, I noticed that people have a harder time recovering from tummy tucks than they do a BBL. Some people have a harder time recovering from just lipo in certain areas than a BBL. So it just depends on the person. So if someone tells you, oh, you need to have 12 massages or you need to have 20 massages, I wouldn't really trust that, because how would they know if they're not continually seeing you on a regular basis? And also, how you feel after you get your first massage will help you determine how often you should be getting them. Like, really assess how you feel afterwards. If you're way too sore afterwards, like, what is your body telling you? If you can't see yourself getting it more than twice a week, then you probably shouldn't be getting it more than twice a week. So how many massages you get is going to determine on a lot of factors, but I wouldn't trust anyone saying, oh, you need 10, or you need 12, or you need 20. Just take it week by week and make a plan for how many massages you'll get a week. And hopefully, if your therapist is trained, they can tell you ballpark how many you should be getting a week. Okay, so this next question came from Facebook. It says, what is the difference if we self-massage or go to a specialist? That is a really good question. So self-massage is something I recommend to all my clients to do in between their sessions. It's just a way to ensure that you're getting circulation, blood flow to your body on a regular basis, because when you're in the faja, you're constricted. You're less likely to get as much blood flow as it needs to heal. You need to take at least 10 to 15 minutes a day, especially in the beginning, to massage your body yourself, especially if you're not scheduled to have a massage that day. Now, the difference between doing self-massage and getting a massage by a specialist, someone who is trained to do it, is that someone who is a specialist can tell you what to expect, what they recommend. They can also see things on your body that you may not be able to see or know to look out for when you're massaging yourself, because how are you supposed to know? They're able to put a little bit more pressure, because right after surgery, when you self-massage yourself, it's gonna feel really strange. It's gonna feel like you're not supposed to be massaging it or something. It's gonna feel off limits and it's gonna feel foreign to you. But a specialist has hopefully seen this many, many times before and can give you exactly what you need and apply more pressure than you normally would, and can give you recommendations on what you can do. So those are the main differences. This next question says, do I need to get massage if I had arm lipo or a thigh reduction? Yes, you need to get massage no matter what area of your body you had it on. More than likely, the massage in those areas, it's just gonna feel good. It's gonna feel like your legs or your arms are gonna feel kind of heavy at first, but it kind of makes your arms feel lighter, like you can move them around more, and it's really, really important. The good news is that you can also do it on yourself. There's ways that you can do that type of massage on yourself because it's easy to get to with your hands, whether that's your thighs or your arms. Even if you had lipo on or reduction on your chin, yes, you need to be massaging those areas. There's a lot of lymph nodes in this area. In this area right here, there's a lot of lymph nodes, and you need to be stimulating those as much as possible. So yes, you still need to be doing massage in that area, but the good news is that you can do it yourself. So you don't necessarily have to see a specialist, but it's still good to see a specialist just so you know what you can do and how often you should be doing it. The last question I'm going to answer today is, let's see, what is lymphatic drainage massage? Maybe I should have started with this one. In a nutshell, lymphatic drainage massage is a type of therapeutic massage that will stimulate the movement of fluids and toxins outside of your body. And the main way that's going to happen is through urination. You're going to pee a lot. If the massage is done well, you'll feel like you have to pee a lot. And that's because the way the movements are done, the techniques that are done, it should be pushing the fluid towards your lymphatic drainage ducts. And those ducts collect that fluid and it pushes it out, and that's going to happen through urination, defecation, or sweating. But the main way you'll notice is through urination. But I recommend seeing a specialist, seeing someone who is specialized in this, you know, seeing their credentials and getting their insight. Something I really believe in is hiring professionals to do what professionals do. So, although you can learn about it yourself and do your own thing and do self-massage, I would recommend seeing a professional as well, because you don't want to play around with your results after surgery. You just don't want to do it. Paying, you know, $1,100, $1,200, you want to protect your investment. So protect your investment by taking care of yourself after surgery. It's very important. When you're thinking about the cost of surgery, include that in the cost of surgery. What is it going to take to preserve your results? Thank you for watching this video. If you learned something new, go ahead and like and subscribe. If I didn't answer your question, feel free to add me on Instagram or comment your question down below, or tell me that you learned something. Tell me what you learned. I'm interested to hear your feedback. I'll be making more videos, pushing them out every single week, so definitely subscribe, and I will see you in the next video. Have a good one.